Getting those EKGs put on the wrong way could cost you thousands of dollars and more. And I'm going to educate you on what you should do. The image here is where the EKGs, the electrodes, should be placed on your body, and the heart is underneath it. Now, if these leads are not placed precisely where they need to be, especially that lead called V2, if it's placed too high up towards the head, a little bit too high up, the electricity generated in the heart that makes your heart beat will be flowing away from that lead, because the lead's too high up, and it will register on the EKG as a downward deflection called a Q wave. And the doctor and computer might tell you it looks like you had a small heart attack. I've seen many of these. Now, worst case scenario, which is too common, is you go to your heart doc. Okay, not unreasonable. But then it could get really bad. The heart doc, he orders a bunch of expensive tests like an echo and a nuclear stress test. Yep, more radiation for you. That may increase your risk of cancer 20 years down the line. And you come back and you're told it's all normal. Thank God. Or worse, you're told something doesn't look good because you had a false positive stress test that you never should have had. You get an angiogram, cha-ching, and you're told it's all normal. Oh, thank God, doctor. Or worse, you get an angiogram, you have a minor blockage that was not even reported on the stress test in a completely other area, and you get a stent you never needed. Cha-ching, cha-ching, cha-ching. I call it the runaway train of bad care. But in many of these patients, this finding can be fixed by just moving the lead an inch below where it was before and repeating the EKG. And voila, not in everyone, but in many, it's normal. Done. You don't need anything else. Sometimes, especially in people with large breasts, it's really hard to place the lead correctly. Or some people have their hearts lower than others, especially people with lung disease. So again, just moving the electrode 1 inch below where they put it. No test needed, no anxiety, no stress test, no echo, no other nonsense. What can be done here? As a cardiologist, it kind of reminds you of the news programs where they loosen a wire on the AC system and see which repairman just puts the wire back and which charges $2,000 for a new compressor. So remember, somebody says, oh, it looks like you may have had a small heart attack, especially in those anterior leads. Ask them, hey, can we repeat that EKG and put the lead an inch below?